Something significant just happened in Washington. And if you receive Social Security, if you're approaching retirement, or if you depend on these benefits to cover your monthly expenses, this is the moment you need to stop and pay close attention. Because two major developments have just emerged from the federal government, developments that carry serious consequences for tens of millions of Americans, and most people haven't heard about either one. The first involves the Social Security Trustees Report for 2026. This is the official government document that tells us the financial health of the Social Security system. And what the latest report reveals is not just concerning. It is a direct warning shot aimed at every retiree, every near retiree, and every working American who plans to depend on this program in the years ahead. The depletion date for the Old Age and Survivors Insurance Trust Fund, the fund that pays your monthly Social Security checks, has moved. It has moved forward. And that shift changes everything about the urgency of this conversation. The second development involves the 2027 cost of living adjustment, the annual raise that Social Security beneficiaries receive to keep up with inflation. Early projections are already circulating. The numbers are higher than last year. That sounds like good news. But when you look beneath the surface, when you understand what's actually driving those numbers, a far more troubling picture begins to emerge. Seniors across the country have been reacting to this information within hours of it becoming public. Advocacy groups are raising alarms. Policy analysts are calling this a defining moment. And the window for Congress to act, to protect the benefits that millions of Americans have spent their entire working lives earning, is now measured not in decades, but in years. We are talking about a system that sends monthly payments to more than 70 million Americans. We are talking about the financial lifeline for retirees who have no other income. We are talking about the healthcare coverage, the prescription drug access, and the retirement security of an entire generation of Americans who did everything right, who worked, who paid into the system, who followed the rules, and who are now watching the ground shift beneath their feet. This channel exists for exactly this moment. We break down the government decisions, the policy changes, the financial rules, and the benefit updates that directly affect your life. In plain English, without filler, without agenda. We are here because the details matter, because the fine print matters, because the difference between knowing and not knowing can mean thousands of dollars in your pocket, or thousands of dollars you never receive. So if you haven't already subscribed, do it right now. Because what we are about to walk through in this video is the kind of information that Washington hopes most Americans never fully understand. Let's start at the beginning. The Social Security Trustees Report is released every year. It is the most authoritative document in existence when it comes to the financial condition of the Social Security program. It is produced by the program's trustees, a group that includes the Secretaries of Treasury, Labor, and Health and Human Services, and it lays out in precise, technical detail exactly how long the money will last. And what the 2026 report says, clearly, officially, on the record, is that the OASI trust fund reserves are now projected to be depleted by the fourth quarter of 2032. Not 2035, not 2034, 2032. That depletion date has moved forward. And when a depletion date moves forward on a program this large, this important, and this politically charged, it means something has changed. Something shifted. And we need to understand exactly what that something is, because the answer tells us a great deal about where this program is headed and what you need to know right now to protect yourself. To understand why the 2026 Trustees Report carries the weight that it does, and why the depletion date moving forward is such a significant development, you have to understand the history of this program. You have to understand how we got here. Because Social Security did not arrive at this moment overnight. This has been decades in the making. Social Security was signed into law in 1935 by President Franklin D. Roosevelt. It was conceived as a safety net, a floor of financial protection for American workers who reached old age, became disabled, or lost a breadwinner. For the first several decades of the program's existence, it operated with relative financial stability. The workforce was growing. Birth rates were high. The ratio of workers paying into the system versus retirees drawing from it was favorable. But demographics do not stay still. As the baby boom generation, the massive wave of Americans born between 1946 and 1964, began entering the workforce, the system expanded significantly. More workers meant more revenue. More revenue meant more benefits. The program grew, and for a time, it grew sustainably. Then came 1983. The Social Security system faced a genuine funding crisis. The trust fund was nearly exhausted. Congress and the Reagan administration negotiated a landmark bipartisan reform package, the Greenspan Commission reforms, that made sweeping changes to stabilize the program. They raised the payroll tax rate. They gradually increased the full retirement age from 65 to 67. They expanded the base of workers covered by the system. And critically, they built up a large reserve, a surplus, in the trust fund, designed to carry the program through the retirement of the baby boom generation. That surplus has been drawing down for years. The Social Security Administration has been paying out more in benefits than it collects in payroll taxes since 2021. Every year, the gap between what comes in and what goes out grows larger. The trust fund reserve, that surplus built up over decades, has been covering the difference. But that reserve is finite, and the trustees have been tracking its projected depletion date for years. As recently as a few years ago, projections placed the depletion date around 2033 or 2034. Then came a legislative development that changed the trajectory in a meaningful way. In 2025, Congress passed a bill that reduced federal income taxes on Social Security benefits. For millions of retirees currently receiving benefits, this was welcome relief. Seniors who had been paying federal income tax on a portion of their monthly checks saw that tax burden reduced. More money in their pockets. A tangible, immediate benefit. But there is a financial architecture underneath Social Security that most people never think about. When retirees pay income taxes on their Social Security benefits, a portion of that tax revenue is returned to the Social Security Trust Fund. It flows back in. It helps sustain the system. When Congress reduced those taxes, when it cut the amount that beneficiaries owe on their benefits, it also reduced the amount of revenue flowing back into the trust fund. Less tax revenue collected. Less money returned to the system. The income side of the ledger shrank. And when the income side shrinks on a system that is already spending more than it takes in, the math accelerates in the wrong direction. The result is what the 2026 Trustees Report now confirms in black and white. The depletion date for the OASI Trust Fund has moved from where it previously stood to the fourth quarter of 2032. That is an acceleration. That is the system telling us, through its own official accounting, that the window of time available for Congress to act has narrowed. The actors in this story are well known. The Social Security Administration administers the program day to day. The Treasury Department manages the trust fund itself. Congress holds the legislative authority to change the program structure, to raise revenues, adjust benefits, or reform eligibility rules. The White House sets policy priorities and shapes the legislative agenda. And advocacy groups, chief among them AARP, which represents tens of millions of older Americans, watch every development and mobilize their membership when the stakes rise. All of these institutions are now aware of what the 2026 report says. The question, the urgent and consequential question, is what any of them intend to do about it. Because the clock is now ticking louder than it has in decades. And the American seniors who depend on this program deserve to understand exactly what that clock means for them. Let's go through exactly what the 2026 Social Security Trustees Report says, and what the emerging 2027 COLA projections mean, with the level of precision and clarity that this moment demands. Because these are not abstract policy documents. These are the official blueprints that will determine what lands in your bank account in the months and years ahead. Start with the Trustees Report. Every year, the Social Security Board of Trustees submits a formal report to Congress. It is one of the most carefully constructed financial documents produced by the federal government. It models revenue projections, benefit obligations, demographic trends, mortality rates, labor force participation, and dozens of other variables to produce a long-range forecast of the program's financial condition. The headline finding of the 2026 report is this: the OASI Trust Fund, the Old Age and Survivors Insurance Fund, the specific account that funds the monthly retirement and survivor benefits received by tens of millions of Americans, is now projected to reach reserve depletion in the fourth quarter of 2032. That is the official number. Fourth quarter of 2032, approximately 6.5 years from now. What does depletion actually mean? This is where clarity is essential, because the word depletion is frequently misunderstood, and that misunderstanding leads either to unnecessary panic or dangerous complacency. Depletion does not mean Social Security disappears. It does not mean benefits go to zero. The program will still collect payroll taxes from American workers every single pay period. Revenue will still flow in. What depletion means is that the reserve, the surplus that has been built up over decades and has been used to cover the gap between what the program collects and what it pays out, will be gone. Exhausted. At that point, the program can only pay out what it takes in through current payroll taxes. And here is the number that every Social Security recipient needs to hear clearly. Under current law, if Congress takes no action before the trust fund depletes, payroll tax revenue will be sufficient to cover only 78% of scheduled benefits. That means an automatic across-the-board benefit cut of 22%. Not a proposal, not a possibility being debated in a committee. Under current law, as written today, that is what happens automatically if the reserves run out and Congress has not acted. For a retiree currently receiving $1,800 per month, a 22% cut translates to a reduction of approximately $396 every single month. That is $4,752 per year, gone. For seniors living on fixed incomes, for retirees without significant savings or supplemental income, that kind of reduction is not an inconvenience. It is a financial catastrophe. Now let's address why this date moved. The 2025 legislative decision to reduce income taxes on Social Security benefits was framed publicly as a win for retirees. And in terms of immediate, short-term household finances, it was. Seniors paying less in federal income taxes on their benefit income have more money available to cover groceries, utilities, prescriptions, and other essential expenses. But the mechanism by which income taxes on benefits flow back into the trust fund created a direct and documented consequence. Less tax revenue collected from beneficiaries means less money returned to the Social Security system. The trustees incorporated this legislative change into their modeling. The result was a forward shift in the projected depletion date, moving the deadline closer than it had previously appeared. That is not speculation. That is the official accounting of the United States government. Now turn to the second major development, the 2027 COLA projections. The cost of living adjustment is the annual increase applied to Social Security benefits to account for inflation. It is calculated using the Consumer Price Index for urban wage earners and clerical workers, known as the CPIW. Specifically, the Social Security Administration measures inflation data from July, August, and September of each year. The average of those 3 months is compared to the same period from the prior year. The percentage increase becomes the COLA applied to benefits starting in January of the following year. The official 2027 COLA will not be announced until October of this year, once the July through September inflation data is compiled and analyzed. But early projections are already available, and they are drawing significant attention. Based on current inflation trends, analysts are estimating the 2027 COLA will fall somewhere between 3.8% and 4.7%. Compare that to the 2.8% COLA that beneficiaries received in 2026. The projected increase is substantially higher. What is driving this? Primarily energy costs and food prices. Both categories have shown persistent upward pressure in 2026, pushing overall inflation higher than it has been in recent years. When energy costs rise, they ripple through the entire economy, affecting transportation, manufacturing, and the cost of virtually every consumer good. When food prices rise, seniors on fixed incomes feel that pressure immediately and acutely. The COLA mechanism is designed to respond to exactly these kinds of pressures. A higher projected COLA means more dollars in monthly benefit checks beginning in January 2027. For a beneficiary currently receiving $1,800 per month, a 4% COLA would add approximately $72 per month, or $864 over the course of a year. That is real money. But as we are about to examine more closely, more money does not always mean more purchasing power. And that distinction is at the heart of what makes the 2027 COLA story far more complicated than the headline number suggests. Here is where the story deepens. Here is where the two developments we have been tracking, the accelerated trust fund depletion date and the rising COLA projections, converge into a single, sobering picture of what Social Security actually means for American retirees in 2026 and beyond. Because taken together, these two data points tell us something that no single headline can fully capture. They tell us that the Social Security system is simultaneously under long-term structural financial pressure and delivering short-term adjustments that, on the surface, appear generous, but may not be keeping pace with the real cost of living for the Americans who depend on it most. Let's start with the financial stakes of the trust fund situation. Social Security is not a small program. It is the single largest federal expenditure in the United States budget. In 2025, the program paid out approximately $1 trillion in benefits to more than 70 million Americans. That number includes retired workers, disabled individuals, surviving spouses, and dependent children. It is a program woven into the financial foundation of American life in a way that almost nothing else is. For the majority of retirees in this country, Social Security is not supplemental income. It is primary income. Data from the Social Security Administration consistently shows that for roughly half of seniors age 65 and older, Social Security benefits represent 50% or more of their total household income. For approximately 1 in 4 seniors, Social Security represents 90% or more of their income. For millions of Americans, it is essentially everything. This is the context in which a potential 22% automatic benefit cut must be understood. We are not talking about trimming a luxury. We are not talking about reducing a secondary income stream. We are talking about cutting the primary financial lifeline of tens of millions of Americans who have no meaningful ability to absorb that kind of loss. The retirement savings picture in America makes this more urgent, not less. A significant portion of Americans approaching retirement age have little to no personal savings outside of Social Security. The shift over recent decades from defined benefit pension plans, which guaranteed a fixed monthly income in retirement, to defined contribution plans, like 401ks, which depend on individual investment decisions and market performance, has left millions of workers with far less retirement security than previous generations enjoyed. For these Americans, Social Security is not a safety net. It is the floor. And if the floor drops by 22%, there is nothing beneath it. Now consider the COLA dimension of this story and why the projected 3.8 to 4.7% increase for 2027 deserves a far more nuanced examination than it typically receives. On the surface, a higher COLA is straightforwardly positive. More money in monthly checks, a larger annual benefit, a recognition that prices have risen and that beneficiaries need additional dollars to keep up. When the 2026 COLA came in at 2.8%, many seniors felt that it fell short of their actual cost increases. A projected 2027 COLA in the 3.8 to 4.7% range would represent a meaningful step up. But here's the critical issue that gets lost in the celebration of a higher COLA number. The COLA is designed to measure general consumer inflation. It tracks a broad basket of goods and services purchased by urban wage earners and clerical workers. It is not specifically calibrated to measure the inflation experienced by retirees. a population whose spending patterns are fundamentally different from the working-age population the index was designed to reflect. Seniors spend a disproportionately large share of their income on healthcare. Prescription drugs, doctor visits, hospital care, Medicare premiums. These costs have been rising faster than general inflation for years, in many cases, significantly faster. An 82-year-old retiree and a 35-year-old urban worker do not face the same inflationary pressures, but they are measured by the same index. The result is what economists and retirement policy researchers have documented repeatedly: a silent erosion of purchasing power for Social Security beneficiaries over time. Even when COLAs are positive, even when they appear generous, the actual buying power of the average Social Security check has declined in real terms over the past 2 decades when measured against the specific costs that seniors actually face. There is an alternative measure, the CPIE, the Consumer Price Index for the Elderly, that many advocates argue would more accurately capture senior inflation. Studies have shown that if Social Security COLAs have been calculated using the CPIE rather than the CPIW over recent decades, benefits would be meaningfully higher today. But the CPIE has never been officially adopted for COLA calculations. It remains a proposal, one that resurfaces in policy discussions periodically and then recedes without legislative action. And then there is the compounding financial pressure created by Medicare premiums. Medicare Part B premiums, the monthly cost of outpatient medical coverage, are typically deducted directly from Social Security checks. When those premiums rise, they effectively reduce the net COLA increase that beneficiaries actually receive. A 4% COLA sounds substantial, but if Medicare Part B premiums also rise significantly in the same year, the net increase to the actual check deposited into a retiree's bank account can be considerably smaller than the headline COLA figure suggests. This is the strategic landscape that the 2026 developments have illuminated. A trust fund moving toward depletion faster than previously projected. A COLA adjustment that, while higher than recent years, may still fall short of the actual inflation experienced by seniors. A Congress that has shown limited appetite for the politically difficult reforms needed to address the long-term funding gap. And a population of tens of millions of Americans whose financial security depends entirely on what Washington does, or fails to do, in the years ahead. The window for manageable reform is now under 7 years. Every year that passes without congressional action narrows that window further and increases the magnitude of the changes that will eventually be required. That is not a political statement. That is arithmetic.